It's Mari McInerney from Croaky here at the ASMIT 2024 conference in Darwin. And I'm speaking with one of our UK speakers. Rachel, would you better introduce yourself and your work, please?
Yeah, hi Marie. So I'm Rachel Harris. I'm the Head of Professional Practice and Education at the Society and College of Radiographers in the United Kingdom, and this is my first time in Australia.
Oh, well, welcome.
Thank you.
It's warm enough here.
It is.
Now, you introduced your presentation today with the fact that it's not one that you normally do. What were you presenting about today?
So today I was presenting as a patient, and I have done that before, but presenting as a patient receiving radiotherapy, but I've never presented as a patient who's received imaging before, so it was a little bit of a different slant for me today, and I wasn't sure how it was going to be, because usually when I present as a patient I don't prepare very much, because it sort of has to come from your heart rather than your head, I think. Whereas when I'm presenting as a professional, it has to be very documented and very precise and sort of based in evidence. Whereas when you're talking about yourself or your own experience, it's quite unique, so it's a little different.
And difficult?
Yeah, and difficult, because you just, as you do it, I even noticed today I did have a little wobble at one point, and as you do it, you suddenly recall a memory or an experience that wasn't quite so good, and one of the next speakers actually also reflected on their experience and also was finding it quite difficult, and it sort of hits you when you hear that, I think.
Can you describe in as much detail as you're comfortable with about what your experience was and just how that felt as somebody working in the field?
Yeah, so I qualified as a therapeutic radiographer back in the 1980s. So I've been in, I've worked in radiography for many, many years. But I've always had a passion in patient experience and what it felt from the patient side. So my own master's degree was in patient experience, and it was quite a traumatic MSc in many ways, in that I was interviewing people who had cancers in their head and neck region and how that felt and how it felt to have cancers that were visual as well. So it's something that's always been within me. I suppose I never thought I'd be a cancer patient myself, but then again, I've never thought why not, because the statistics are there. But when it happens, it's quite a leveler to see it on the other side, and you suddenly appreciate how, unfortunately, we're very busy clinically, and sometimes it becomes, I've done it myself when I work clinically, you say to your colleagues, oh, what's coming next? And you'll say, oh, it's another breast, or it's another prostate, and actually, the breast doesn't come in on its own, it comes with a human being. And that human being, every human being, in a day, you never know what's happened to them, do you? They could have had trouble driving to the hospital, parking, all those things, and they all affect your experience on that day. And for me, I think one of the things that really struck me was about modesty. I've never been with somebody who's really been very happy uncovering much anyway. But when I went into the treatment room for my radiotherapy, I had to obviously strip to the waist, which I understood that's setting up. But when they left the room, they left my unaffected side also uncovered, which they didn't need to do. And this happened for 3 days in a row, and on the third day I came out and actually cried. And it made me realise just how impactful that was to me. And just a little thing, it takes a second to put a cover over somebody, a second.
Were you surprised at some of those things that would happen in your own workplace's environment, in your own profession? Would you have thought that these were things that were well established, or was it like, oh yeah, I've done that too?
Yeah, I recognised some things that I'd probably done myself. I do think I was always very cognizant of people's modesty anyway, so maybe that's why it affected me as well when it happened to me. And I also knew that it didn't have to, I suppose for me, I knew it didn't have to be like that. And so that made it maybe harder. Maybe for some patients, they think that it has to be that way. But it is leveled, isn't it? It makes you look at your practice in a different way. Makes you think. You have to just think.
And that was one of the questions you got asked was, has it changed your practice? Could you explore that with us?
I mean, I don't work clinically now myself anymore, but my practice already got changed clinically after I'd done that MSc with those patients, I think, because that was a very qualitative piece of work, and I was getting really quite traumatic recounts from those patients. And that last quote that I put up, I use that as much as I can in slides because it levels me. When somebody says to you, we are people, not just bodies, that's a powerful statement, isn't it? Yeah.
What would you like to see change, particularly in the profession?
I'd like people to remember that there's a person. And when we talk about person-centred care, a lot of people think, oh my goodness, Rachel, that's going to add time. We haven't got the time to do that. It doesn't take time. It doesn't take time to say, hello, my name is Rachel, and find out just a little bit about that person. Because actually, it will save you time in the long run. And in fact, one of the last presentations in that session was about Muslim women. And actually, it struck me then that if the people who we're treating just spent a little bit of time up front finding out who that individual was, you actually save time further down.
That's the interesting thing. Another interesting thing you said was, in terms of critical self-reflection, you copped some criticism for sharing your story. Can you say what that is and why you understand that to be and where it happens?
Since I've had breast cancer myself, I sort of follow a few ladies on Twitter who also have cancer, and I hear them say similar stories. So since I've had cancer, I've lost friends I've gained friends, but I've lost friends. But I was shocked when professional people from the same sort of career as me would say things like, they didn't want to hear about my cancer because they found it offensive. I find that a very strong word. And you can probably tell, because I'm still talking about it, how it's affected me. And also curious that people will say things like, by talking about your cancer, you're sort of almost being self-indulgent, and that I guess that's maybe what people think. And when I speak to other cancer patients who are also sharing their stories, we do it because if we can help just one other person's experience, just one, it's worth it.
Why would you think anyone would find it offensive? Did they say?
No, they never said, and I don't know why. And I guess maybe for some people it is. So now when I start my talk, I try to preload it now with, there might be something here that you might not like me saying. And it's also being mindful that, when I'm standing in an audience as well, there will be other people in the audience, as we saw today, who also have had cancer diagnoses, and they come up to you afterwards. But they're usually very reassuring when they do. But it's hard. It's you don't share your story lightly. And every time you do it, it takes a little bit of you.
Yes. Thank you very much for sharing it again with us. Anything else you'd like to say in terms of the conference or your own messages?
Yeah, no, it's been great. I mean, day one seems very long. It seems like, it's great, the different streams that you can go into. I mean, that stream was great because people were really listening about individuals and about patient voice, which really resonates with me. And tomorrow I've got a session on values-based healthcare. So I've got a bit longer, and I won't be talking about me. I'll be talking more from a professional perspective, and again about that personalised care. So I think that's coming across really strongly, actually, in the sessions I've been in.
And that on values-based care, what will be your main messages there?
So the main message in the values-based care is a bit like I said just now. People say that they can't do values-based or personalised care because it would take too long. And actually, it's proven that actually if you take time to just listen to a person and find out what their preferences are, you can actually save time and money. So sometimes you might recommend a procedure to a person, but if you haven't given them the full information, that's not informed consent, and also they might have made a different decision if they had different facts in front of them. I think some of the decisions that happened in my healthcare, if I'd had more information, I might have made different decisions, and some of those decisions would have actually saved money. So it's important, I think, that it's a partnership. And so previously, healthcare has always been traditionally very paternalistically driven, and that you tell a patient this is what you need and they would do it. But that's gone, and we need to move from that, and we need to move to a partnership of care. So that's what I'll be sort of discussing tomorrow.
Fantastic. Thank you very much.
You're
and I
very
hope you
welcome,
have
Marie.
fabulous health.
Thank you, Marie.